It's been a while since I've reacted to one of Derek's videos. Let's react to this one, Going Deep on Hair Loss Prevention Drugs with Peter Attia, From Tame to Nuclear.
By the way, how important is DHT post-puberty?
It's not necessary or mandatory. Like, you will survive and likely thrive just the same with a lack of DHT almost entirely. Like, even when a lot of people will demonize 5-alpha reductase inhibitors, and justifiably so in some cases. But even when you look to literature that compares placebo versus finasteride versus dutasteride, side effect profiles are pretty similar even.
Yeah, I mean, some people don't talk about exactly what Derek is saying. The number of people who have some of these side effects, specifically sexual side effects, even in the placebo group, it's usually at least 1% in the big, large studies on especially finasteride, but also dutasteride. So he's absolutely right that even in the placebo group, people experience some of these side effects. The incidence is definitely a bit higher for sexual side effects for medications like finasteride and dutasteride, but it's still relatively low. I think if you just polled somebody who's doing some initial research into these medications to see if it's right for them, they might think that the incidence is closer to 50%. But in reality, we're looking at numbers like 2 to 3% for finasteride and maybe a little bit higher, like 4 to 6% for dutasteride, but it's not 50%.
Dutasteride and finasteride being two drugs that block 5-alpha reductase, used initially for reducing prostate size because DHT disproportionately drives prostate growth, but also used for, I would say used more for hair loss now.
Yeah, dutasteride is going to be the more potent cousin of finasteride, and finasteride is going to block type 2 of the 5-alpha reductase enzyme, whereas dutasteride blocks types 1 and 2 of 5-alpha reductase, making it a stronger 5-alpha reductase inhibitor. While finasteride reduces DHT levels by about 60 to 70%, dutasteride can reduce serum DHT levels by 90%. So it makes it potentially more powerful in lowering DHT levels, but on the flip side, it has a slightly worse side effect profile. And dutasteride has a much longer half-life, so it's in your system for longer than, for example, finasteride.
We have talked about this on 2 podcasts previously about post-finasteride syndrome, which is a debatable idea. In other words, there is not a clear consensus in the urologic literature about even the existence of this, let alone the prevalence, let alone the reversibility of it.
Yeah, I try not to discredit the existence of post-finasteride syndrome, but it's something that I've never seen in my clinical practice. And when I talk to some very senior hair transplant surgeons and other hair doctors, they also have never seen it in their practice. So while there are, of course, forums dedicated to this, and I think a nonprofit where people talk about post-finasteride syndrome and what their experience has been, it really hasn't been borne out well in the literature or in actual clinical practices. But I definitely don't want to discredit that it could exist.
What's your stance on 5-alpha reductase inhibitors? Just at a...
Yeah, I mean, look, I think I'll be honest with you. I never really paid enormous attention to it until about a year ago. And I think right now our stance is I probably wouldn't start somebody on it.
I mean, I don't know how actively Peter is treating hair loss in his practice, but for those of us who do treat hair loss, and specifically androgenetic hair loss, which is the most common type of hair loss for men and women, 5-alpha reductase inhibitors like finasteride are really crucial for being able to protect people's hair and to keep it from falling out. Now, does it have some side effects? Potentially, yes. It can, of course, in different individuals, but it's still overall a very safe and well-tolerated medication. So we start people on it all the time, and if they have a side effect, we address it. We usually will take them off the medication, wait for the side effect to resolve, and then we restart at a lower dose.
If you're talking about it from a hair loss perspective, again, not something I obviously know much about, I would say, and they're going to go and see a hair doctor who's going to try to give them 50 different proprietary compounds.
I don't do that. I don't do that. We keep it very simple. My 2 go-to medications are, for men, are finasteride and minoxidil, both as pills. That is what I recommend as the first line medical therapy for androgenetic hair loss. Now, in women, it's a little bit different, and we have a whole video on women's hair loss if you want to check that out. But I do not give a whole lot of proprietary compounds and all that kind of stuff because it's usually not necessary. For the medications, I always send people to our Feel Confident website where you can get those basic medications. And for people who don't want oral finasteride because they're worried about side effects, they can always try the topical formulation that's going to be weaker, but it's also going to have a lower incidence of side effects.
I would encourage them, if they've never taken it before, not to, because I think there are enough other compounds, oral minoxidil, topical minoxidil.
False. All those other compounds are for stimulating some of your finer, more villous hair to make it more terminal, to make it thicker, to make it a little bit fuller. Now, that's helpful, but nothing will prevent the progression of your hair loss like these 5-alpha reductase inhibitors. And that's why finasteride and dutasteride are so important in preserving hair, and nothing else will compare. So while you can stimulate hair, it will eventually be a losing battle where the hair that's programmed to fall out will fall out because most of it is androgen driven. So you need to get at the root cause, at the root mechanism, if you want to hold on to your hair. Now, are there other things you can do to help stimulate the growth and, temporarily see some improvements? Sure. But ultimately you lose. Most people will lose if they aren't on a 5-alpha reductase inhibitor. And that's just kind of how it goes. It's always tempting to try something that doesn't have sexual side effects. I get that. But it's going to have a different purpose. It has a different indication. If it's just that you want a little bit more fullness, sure, try minoxidil, try laser light, try microneedling. But it's not going to be for truly preventing further loss.
Topical 5-alpha reductase inhibitors, PRP, transplants.
Remember, topical 5-alpha reductase inhibitors still have systemic absorption, and they're still going to have the potential of giving you sexual side effects. It might be a lower incidence, but it's still going to be there. And hair transplants are not to be used, in my opinion, in place of medical therapy. And that's what most hair doctors around the world believe. We like to stabilize hair with medical therapy, and then we build on that with hair transplants when it's indicated.
I think there are enough other tools that you can do to avoid the small but not necessarily zero risk of something going wrong in terms of sexual side effects.
We have a video about all the different side effects that are possible with finasteride, so make sure to check that one out.
Several of the drugs you just said have either comparable side effect profiles, like topical finasteride. You end up with the same burden of 5-alpha reductase inhibition.
Yeah, Derek makes a good point here. It's possible, especially with high concentrations and high enough dose of the topical finasteride, you could be suppressing your DHT levels even beyond the suppression that you get with the standard oral dose of finasteride at 1 milligram. And people don't always realize that. At a high enough quantity of the stuff that you're applying daily, you could be suppressing those serum DHT levels quite significantly. So it's not without its potential side effects, sometimes worse even than taking a pill a day.
Topical dutasteride is interesting because it may have some capacity to stay local, especially if you do mesotherapy.
Still goes systemic. There's still plenty of data to support the systemic lowering of DHT levels, even with topical dutasteride.
I wasn't aware of that difference.
Yeah, it's thought to be the molecular.
Is it just hydrophobicity?
It's more the molecular mass of the drug.
Derek is right that the molecular weight of dutasteride is larger than finasteride. And I have the numbers here. Dutasteride 528, finasteride 372. So that might keep it from dispersing as much, but it's still going to have the potential of going systemic, even with topical application or with mesotherapy, which means injections of dutasteride into the scalp.
And to be clear, you're right. I mean, I don't think that, systemic minoxidil is necessarily a benign drug. And the other thing is, nobody really can give an explanation for what the right dose is. If you look at how people are dosing oral minoxidil, it's insane.
No, I mean, there's pretty good agreement across the board as far as like in the hair literature and just hair doctors in general around the world are giving similar dosages of oral minoxidil. And that's usually for men about 2.5 milligrams to 5 milligrams daily. And for women, usually cutting that dose in half. I'm usually starting women at 1.25 milligrams daily and men at 2.5 milligrams, sometimes going up to 5 milligrams. And at the most recent ISHRS hair conference that I made a video about, there was some talk of bringing the dosage of oral low-dose minoxidil up to even like 7.5 or 10 milligrams daily, and some people showing that that's still quite safe. Now that's newer data, at least with its use for hair loss. But again, we know that the side effect profile of oral minoxidil is dose dependent. So as we go to those high higher dosages, my concern is that we're going to see potentially more effusions, whether that's like leg swelling or it could be even pleural or cardiac effusions, which could be a big problem. So that's the type of risk that I'm worried about. And as we raise the dose, then we might see more of those cases.
I don't like to be in the business of prescribing things for which I don't have a great understanding, which is why I'm not in the business of treating hair loss. Not because I don't think it's, something worth, addressing if it bothers someone, but I think the bigger issue is it would be really awful if in trying to treat a cosmetic condition like hair loss, you induced a devastating consequence on your endocrine system.
I mean, that's definitely one way to look at it, but the cosmetic appearance of someone can really affect them significantly in a very tangible way. It could affect the way that they live their life. It could affect events that they go to. It could affect, how they are perceived by others and how they perceive themselves being perceived by others and all of those things. And just the use of hats, the not wanting to go into the water because you don't want to get your hair wet because it shows how thin everything is. And for some people, that has a massive psychological impact. So many people are willing to take some of these risks with medications, with surgery, because they don't want to, worry so much about their hair loss. And I think that in many cases can be understandable. And if you're interested in my take on why I think people actually get hair transplants, make sure to check out our video on that topic.
Now, it also appears that if you've been on finasteride for a long period of time and you're not experiencing any of these side effects, you're probably fine. So I also don't want this to turn into like someone listening to this who's been taking Propecia for 10 years, who's never had an issue, going like, oh my God, I got to stop this stuff.
Yeah, I mean, most of my patients have been on finasteride or Propecia for decades, right, at this point. And the ones who we start on the medication, almost all of them do great. And of course, we're still going to have that percentage we talked about, the 2 to 3% that do experience some sexual side effects or some other side effect. And we, of course, address that right away. We don't tell them, oh, just keep going, everything is fine.
The literature would suggest if you're going to have these side effects, you're going to have them in about 6 months.
Usually even sooner. Usually within the first month, people who are going to develop a side effect, they feel it more or less right away, right? Within a few weeks. And it's not subtle. It tends to be pretty obvious when they have one.
In general, when it comes to hair loss, the problem is oftentimes the treatments, if it doesn't actually interact with the AR or inhibit the potential for stimulation or agonizing the AR through DHT reduction or even systemic antiandrogens, not that I ever recommend that, you are essentially just putting a Band-Aid on the issue. So if you stimulate growth with minoxidil, you are still not preventing further loss.
Yeah, exactly right. I agree with Derek 100% here. He's right about this one.
If you get a transplant, you are putting hair on your head, but you're not preventing further loss of, your actual existing hair. So oftentimes it's like you're almost trying to row against a current or something. And it's like you are continuously getting pushed back. And eventually you're going to get to a point where you have so few visible hair follicles even left that are healthy that it doesn't matter how much you've been on minoxidil or what have you. And oral minoxidil, it's like, it's definitely effective. But I think it should be reserved for people who have weak response topically. Because topical seems to be far more tolerated.
Oral minoxidil is extremely, just based on my clinical experience, is extremely well tolerated with very few to no side effects. I mean, we get maybe at most like 1 out of 100 who complains of maybe like palpitations or a little bit of lightheadedness, and we can typically get rid of that by just cutting the dose in half. And the actual impact as far as on the hair is concerned is going to be more impressive with the oral minoxidil compared to the topical. And I see that playing out in my practice on a daily basis. So I usually just jump to oral minoxidil instead of telling someone, oh, try the topical. Also, the compliance is much worse with topical minoxidil. So we really do prefer oral minoxidil in combination with oral finasteride for most of our male patients.
Finasteride in itself, it seems to be like, I don't want to try and come out and say I'm a proponent necessarily. I try to play take a balanced approach to it. But
I'm a proponent. I mean, if someone cares about preserving their hair, then I'm a big proponent in men for the use of finasteride.
the prevalence of side effects is not nothing.
I mean, what medication has no side effects? I mean, you could be taking Motrin, Advil, and get a stomach ulcer. You could be taking too much Tylenol and develop liver problems. I mean, even the medications that seem so benign and over the counter are still fraught with plenty of potential side effects. That's how medications work. If they're going to potentially do some good for you, they can also, on the flip side, create problems for you, especially at higher dosages and outside of that therapeutic window. But again, even at a standard dose, someone might fall ill on just some topical, over-the-counter medication. So every medication has its potential drawbacks.
If a person cares as much about hair loss as they do about heart disease, and by that logic, DHT is causal.
Which sounds absurd, but let's just, run with it.
I would posit that there are lots of people who care more about hair loss than heart disease.
The psychological stress for some people is significant and should not be overlooked by the seemingly the silliness of, just shave it, bro. Like, it's not a big deal. There's tons of successful people who are bald. It's like, yeah, sure, but maybe I just deal with.
Although I think there's a statistic that no bald person has ever been president of the United States.
Oh man, there goes my run for presidency. Crap. I also wasn't born in this country, so I had no chance.
Now, you mentioned when you were going through your insane anabolic steroid use, you, at a very young age, if you're in your early 20s, were already starting to lose your hair.
Yeah.
So how did you reverse that?
Yeah, remember that testosterone is going to lead to the acceleration of hair loss. So guys on TRT, for example, I strongly encourage to be on finasteride. And usually when they start on TRT, they notice that accelerated hair loss. So sometimes they then accept that finasteride is something that they sort of need to prevent further loss.
Part of it was just dropping the dose significantly and eventually just going down to replacement therapy. But it was the introduction of 5-alpha reductase inhibitor, initially finasteride, and then thereafter I introduced and I wouldn't necessarily recommend this blindly, but a topical anti-androgen that's experimental, never actually received FDA approval. There are some that are in the FDA pipelines right now that actually look promising and have safety data behind them and whatnot that I'm watching closely and hope one comes to fruition, because these are essentially compounds that compete for the androgen receptor locally, but do not have systemic anti-androgenic activities.
Again, that's what we're hoping for. We'll see, like you said, what the trials end up showing. But there are several topical anti-androgens that are currently being studied. They're either trying to block the androgen receptor or they're trying to degrade the actual androgen receptor. And I covered some of these molecules in my talk on the ISHRS hair conference, so make sure to check out that video if you're interested.
I also use a ketoconazole shampoo, but it's like a very mild anti-androgen. It's mostly just a good shampoo.
It's also anti-inflammatory, so for patients with seborrheic dermatitis, ketoconazole can be great as well.
Those two things and decreasing the burden of androgen significantly were fairly effective at getting me not to baseline, but,
Meaning you never regained.
No. Yeah. And that's the thing with hair. That's the sketchy thing, is even if you're trying to decide, maybe I should treat it, maybe I shouldn't, I'll think about it for a bit.
It's going to be too late. It'll be too late by the time you decide.
The visual representation of loss is typically not apparent until you've lost a lot of ground.
Yeah, by a lot of ground, we typically say about 50%. After about 50% of hair loss in a given area, you're going to start to see a thinner appearance to that area.
You could pull a handful of hair out of your head and see no difference whatsoever. Once you finally notice diffuse thinning or recession, it's not something you've been looking for carefully because you've never dealt with it. So oftentimes once you actually notice it in a picture or in heavy downlighting or something, you've already lost 20, 30% plus of your hair.
More, 50% plus.
And there's no guarantee that's coming back. So preventing.
So you're saying, did you regain hair that you had lost with this protocol? Or just completely stop the...
Some regrowth, but expecting yourself to get back to baseline.
Yeah, that would be unrealistic. Exactly. So thinking that you're going to reverse it like 10 years is usually not realistic, but trying to prevent further loss and adding some degree of fullness, especially with the use of, say, a minoxidil or a laser cap or microneedling, can be helpful. But expecting reversal back to how you were years ago is just It's not going to happen. And that's where a transplant comes in. If everything is stable and there's good donor supply and people have realistic expectations, that's where we come in with a hair transplant or a few hair transplants to make things even better.
The longer you wait and let hair follicles miniaturize, the more permanency you are risking. So making back ground is way harder than preventing yourself from losing it in the first place.
And that's a great point. The issue is that people start to lose hair fairly early in their life. So most guys will lose the majority of their hair, usually between 25 and 35, as far as accelerated hair loss. And then there's like slower hair loss that still continues, obviously, beyond that. But in that decade, people are trying to figure themselves out. They're trying to improve their careers and figure out, what job they're going to have and all of that. And that's not the time that they're necessarily so fixated on their hair. And then when they start to notice, big pockets opening up and the recession and the crown loss and all of this, well, then it's in a way too late to get back to how exactly things used to be. But usually we can still make it significantly better with the right combination of medical therapy and sometimes surgery.
Let's make sure we give people the names of these compounds you're using. So
finasteride is like the main primary 5-alpha reductase inhibitor.
And you take 1 milligram of that daily?
I take dutasteride now.
So you take 0.5 milligrams. Is that 0.5?
Yeah, I take 0.5 a day. So that is soft gel that essentially wipes out systemic DHT.
Remember, about a 90% reduction in systemic DHT with the dutasteride. But there are some patients that continue to lose hair even on the standard dose of dutasteride. So I've had to increase people's dutasteride levels before. I've gone up as high as 2.5 milligrams daily for, I can only think of 2 patients from the top of my head. But yeah, it's possible that the 0.5 won't be enough to prevent further loss. So just because you're on it doesn't mean like, okay, well, I'm doing what I have to do. Like, you still have to monitor your hair and see if it's stable or if it's continuing to thin out and recede, and the 0.5 daily might not be enough. So again, that's why it's important, I think, to be monitored by an actual hair doctor who can adjust those dosages for you and work with you. And you can talk about side effects. You can talk about, how well your hair is doing overall.
I think one of the guys with the highest IQs on the planet has been on dutasteride for decades, if that's notable for anyone.
Is he talking about Elon Musk? I don't know what he's talking about exactly.
Dutasteride right now is the only thing I take more out of convenience, because a topical application schedule can be quite burdensome.
But when you were doing that big salvage effort in your early 20s, what was the rest of the stack?
Oh, it was topical application of something called RU-58841. It was like a experimental anti-androgen.
Yeah, there's not enough data, in my opinion, for that compound for me to recommend it clinically.
I don't necessarily recommend people use RU-58841 when there are actually alternatives with human safety data on the horizon. With that said, it's also hard to tell me, however many years ago, that wait, because you only have so much time, right? So I'm not going to sit around.
And what are these things that are on that have more safety data coming down the pipeline?
This company called Kintor has a compound called pyrolutamide.
That's a company out of China, and that's one of their compounds. They call that one KX826. There's also clascoterone, which is FDA approved for acne, but they're trying to get it approved for hair loss as well. And the androgen receptor degraders that I mentioned previously, one of the compounds being tested is called GT20029.
Right now, the most effective things are going to be 5-alpha reductase inhibitors and minoxidil. On top of that, everything else is like little sprinkles on the cake, essentially.
I'm with him that, in my opinion, the finasteride or dutasteride and minoxidil is first-line medical therapy. Everything else is going to be less significant, so that includes PRP, low-level laser light, microneedling, pretty much any other treatment that's been reported to be somewhat successful for hair loss is going to pale in comparison to the first line.
The most crazy hair loss reversals you will see are always in men transitioning to women who use female hormone therapy. I would never recommend anyone do that, but it's a pretty interesting data set to like pull from. So
estrogen and progesterone would promote hair growth.
Yes, that's absolutely true.
Especially progesterone can really thicken hair.
Progesterone.
But this is in women. I mean, I have no idea.
Yeah, I'll sometimes treat transgender women in my practice, and for sure, the use of hormone replacement therapy is going to improve the state of their hair, no doubt. I really enjoyed Derek's take on medical therapy that's useful for preventing hair loss and potentially regrowing some hair. I think it's a very important part of the equation when we talk about hair restoration. And I think Derek was spot on with many of his points. Maybe one day I'll sit down with Derek and we'll talk about hair restoration in its entirety.